As we have proven time and time again, we are here to bring you the most important news stories of the day. And for those of you who haven't stayed current on the tooth fairy going rate, I'm here for you. It does change with time. It actually hit an all-time high, quite staggering, actually, in my opinion, of $6.23 just a few years ago for an all-time high per tooth cost. Well, in 2024, we've seen a decline. Is that a sign of the economy? Is it a sign of the recession that could be looming behind every corner? Because now the Tooth Fairy's average payout is only $5.84. We're almost down 50 cents from just a year ago. And a single tooth, first tooth cost, so that very first little baby lateral or the traumatic upper central incisor that knocks out from your brother's forehead, used to be worth $7.29 in 2023, now is only worth $7.09. Now, this is just polling data. Some kids are probably getting 20 bucks. Others might just be getting $1. But, I do think this could be a pretty strong metric. I'm kind of surprised I haven't seen it on the business networks, kind of forecasting maybe challenging times ahead. So if you're looking at the cost of eggs and milk, and going, gosh, I think things are getting bad, you should be looking at the reimbursement rate for single tooth fairy under the pillow fees. And apparently we're starting to see a dip. So just keep that in mind, parents. It's okay if you feel like you can't do a full 5, okay? And making the rest of us look really bad in the process. The other interesting story comes out of Chad's great state of Texas. So we talked about the story a few months ago. If you'll remember, the FTC put out a ban on non-competes. It was a pretty aggressive document and actually had a pretty big impact in the dental industry. It certainly was going to be pretty impactful for associate docs and for individuals looking for employment or temporary employment. The non-competes could impact where they could go after that job. The FTC said massive ban on non-competes, except for maybe high-income earners and practice owners that had sold. Those might not change, but general associate non-competes were going to go away. Well, we're seeing our first shift in that. There was a court in North Texas, federal judge that came out for the first time and said this was outside of the scope of authority of the FTC to be mucking around with non-competes, and said that they would not uphold that change. Now, I'm sure this will now get challenged all the way up to the Supreme Court. But for me, this is the first indication, the first ruling that we're seeing post Supreme Court overturning the Chevron Act that basically allowed a lot of regulatory legislation to happen where FTC, CDC, the NIH, et cetera, could come up with regulatory statutes that kind of became law and maybe weren't within the jurisdiction of what Congress had originally charged them with. Well, she cited specifically in her ruling that this was not within the scope of the FTC as charged by Congress. So the reference back to the Supreme Court decision. And if that's the case, the likelihood of it being overturned by the same Supreme Court that just ruled against the Chevron Act will likely not happen. So for those of you who are banking on the non-compete because you employ or you're an associate and thinking non-competes won't be upheld, you might want to think again. And for those of you employing a lot of associates who had some concern about non-competes and them being overturned, just stay tuned. The sort of a moving target, I think, at this point, but probably best to operate as if no non-competes will be overturned at this point. And the Texas court there has sort of set the precedent. So looks like we might just be going back to business as usual with non-competes. And with that, that's the news.